Today on Investigate TV Plus, a mother shares her pain in the hopes of helping others.
You don't want another mom to feel it. I do. You know, it's just awful.
We sit down with families forever changed by fentanyl, and we take you inside a government lab where agents work to get the drug off the streets.
It's frightening. It's frightening not just as the DEA special agent in charge, but as a member of this community, as a father.
A medical facility accused of playing God. A man claims staff placed a Do Not Resuscitate order on his sister without his knowledge. Our investigation reveals they're not alone.
This has to stop. They can't be doing this to other people. You're dealing with people's lives.
We find out what's being done to protect patients.
Plus, a decision by his niece cost him his leg, but saved his life.
When I found out she did, I said, thank you. I told her several times that it's a bill I can never repay.
See how he paid it forward and became part of a perfect pair.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. Thanks for joining us. I'm Lee Zurich.
And I'm Tisha Powell. We begin on the front lines of the drug crisis.
The U.S. Drug Enforcement Administration calls fentanyl the single deadliest drug threat this country has ever encountered, 50 times more potent than heroin.
To put that into perspective, consider this. Just 2 milligrams of fentanyl, an amount that can fit on the tip of a pencil, is enough to potentially kill.
And if you think it's only sold in dark alleys or on the dark web, think again. Reporter Heather Graf got rare access inside the DEA's lab to show you the danger and what you need to know to keep your family safe.
At the U.S. Drug Enforcement Administration's headquarters in Arlington, Virginia, you'll find the lobby walls lined with photographs, a display known as Faces of Fentanyl.
If you knew him, you loved him.
And it's here that Debbie Evans often reflects on her son's life and his death.
When I go there, I feel like I'm visiting him.
Jamie Evans was 34 years old and struggling with addiction when she lost him in early 2020.
So we went to the hospital, and, you know, he was on a ventilator.
Because he had overdosed. When did you learn fentanyl was involved?
When we got the report, the autopsy report, when we got that back. They need to figure out a way to stop it because it's killing all our kids.
According to a recent report from the National Vital Statistics System, U.S. overdose deaths involving fentanyl more than tripled between 2016 and 2021.
This is a nationwide problem.
Jared Forget is the special agent in charge of the DEA's Washington division that covers D.C., Maryland, and Virginia.
In my 20 years with DEA, this is the most deadly drug that I've seen.
What makes it so dangerous?
It's made in Mexico, largely in Mexico, by 2 cartels, Sinaloa and Cartel Jalisco, with chemicals largely sourced out of China. Because it's man-made, they were able to make it that much more potent.
And more often, he says fentanyl is being pressed into counterfeit prescription pills made to look exactly like real medications. For instance, the authentic oxycodone M30s seen here on the left and a fake version on the right.
A lot of people are taking these pills thinking that they're taking one thing when in fact they're getting a fake pill.
So a big part of the DEA's efforts focus on getting those pills off the streets. In 2022, the agency says it seized more than 58 million fentanyl-laced fake pills and 13,000 pounds of fentanyl powder, equivalent to more than 387 million lethal doses. That's enough to kill every American. And all of those pills end up in DEA laboratories like this one.
It's very scary.
Where supervisory chemist Jacqueline Brown and her team are tasked with testing the tablets.
Yes, so there's about 14,000 pills in this bag.
Working to determine if fentanyl is present and how much of it in each tiny pill.
The chemist would take a sample, dissolve it into a solution, and then put that solution into a vial. 6 in 10 pills contains a lethal dosage.
And though they are experts in this field, Brown says even her highly trained chemists can't immediately tell the difference between counterfeit pills and the real thing.
The best advice I can give is do not take pills from anyone but a pharmacy prescribed by your doctor.
She also showed us what's being called rainbow fentanyl that almost looks like candy.
They are very dangerous.
Because the DEA believes Mexican cartels are using these brightly colored pills to target young people.
They want to get more people taking this drug so they can drive up their profit margins.
And they don't care if people die in the process.
No, they certainly don't care if people die. Young people are online. They're on different applications such as Facebook, Instagram, Snapchat, TikTok. Members of these criminal organizations are actually out there pursuing people to take these drugs and to dupe them into taking these fake pills.
What do you think it will take to stop this?
It's an ongoing battle, and we work every single day. DEA, we can't do it alone. And when I say that, of course, we have to work with our law enforcement partners, and we do that, and we do it very well.
The analysis done in this lab often key in sending drug dealers to prison.
We take the results of their testing, and then we use that in court.
But Special Agent Forget will tell you they also need help in the form of public awareness about the dangers of fentanyl and fake pills.
It takes the entire community. It takes all of us.
You don't want another mom to feel it. I do.
It's why Debbie Evans now shares her son's story every chance she gets, from rallies and marches in the nation's capital to online forums and Facebook groups, to the artwork that's become her own version of the DEA's Faces of Fentanyl display.
Jacob and Keen.
Often used as a visual when she speaks to parents and even lawmakers.
I started doing it to honor Jamie.
This ever-growing collage depicts Jamie alongside dozens of others whose families Debbie has gotten to know over the last few years.
These are all his new friends in heaven now.
Families that, like hers, were forever changed by fentanyl.
I think it'll help other people, if they see moms putting out the stories of their children and how fentanyl is killing them, that maybe they'll be a little more aware and they won't have to have that happen to them. You can't describe how much it hurts every day.
According to the CDC, U.S. overdose deaths topped 100,000 in 2021 and again in 2022. The DEA says there is no question illicit fentanyl is fueling those numbers.
And we're going in depth with advice on how to talk to your family about this.
The DEA's One Pill Can Kill campaign reminds people to avoid any pill that isn't prescribed by your own doctor.
It also warns of emoji drug codes being used between drug dealers and teens. Keep an eye out for these, representing fake Percocet, oxycodone, Xanax, and Adderall. And make sure your child knows no pill on social media is safe.
Another tip for parents is to help your kids create an exit plan so they know what to do if a friend is pressuring them.
From weight loss to clear skin and controlling cholesterol, coconut oil is touted for its health benefits. But still to come, we uncover a claim that can be the life or death difference for some.
Plus, potentially life-saving measures not allowed.
And I said, you don't understand, she's not capable of signing a DNR.
A family says medical staff placed a Do Not Resuscitate order on a loved one with disabilities without their approval. What our investigation revealed about dozens of other patients.
You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes. Claims medical facilities are playing God with patients' lives.
They involve Do Not Resuscitate orders placed on people with mental disabilities unknown to their families.
Investigator Andy Perotti explains why some families believe their loved ones died too soon and how it could happen to anyone.
Leona Milne's family remembers her as their biggest baseball fan.
She was a tremendous Braves fan.
Today, her younger brother is left to visit her here.
How did you find out that she passed away?
I walked in and found her dead.
It all happened here at Roselane Health and Rehabilitation Center in Marietta, Georgia in April 2018. The 73-year-old was admitted to help her walk again following foot surgery, a temporary stay. But within days, nurses noticed something wrong.
They called and said she was having a little trouble breathing.
Chuck says he begged the nurses to call an ambulance, the hospital less than a mile away, but they wouldn't do it. That's because Leona had signed this, a DNR, or Do Not Resuscitate order, which prohibits medical staff from performing life-saving measures like CPR if a person's heart stops.
And I said, you don't understand, she's not capable of signing a DNR.
Why wasn't she capable? Leona grew up with a mental disability her entire life, the cognitive ability of a 9 or 10-year-old as an adult. Mike Prieto represents Leona's family in a pending wrongful death lawsuit against Dr. Sarah Sambandham, the facility's former medical director and the physician ultimately responsible for Leona's care.
When we first looked at the case, we really just looked at it on whether or not Ms. Milne had mental capacity to execute a DNR. It wasn't until later that the rest of the story came out.
This is a DNR form for Ms. Milne.
The rest of the story revealed itself during this 2021 deposition of a social worker who worked at Roselane. Like many states, Georgia law requires 2 doctors and an ethics committee to sign off on any DNR ordered for someone mentally disabled or incapacitated. The social worker said none of that happened at Roselane. In Leona's case, her DNR was photocopied with 2 doctors' signatures already on it before the form was ever given to Leona. One of the doctors resigned before Leona was ever admitted.
Were they original signatures or were they photocopied versions of signatures?
We had copies of those.
It wasn't the only time it allegedly happened. These are 194 DNR orders, part of the lawsuit, that were allegedly photocopied with doctor signatures on them before patients were ever evaluated. Through her attorney, Dr. Sambandham declined to be interviewed, but denies any wrongdoing in court filings. According to this August deposition, she claims she had no idea the practice was happening in her 4 years as the facility's medical director, saying it had never come up. According to records from the Centers for Medicare and Medicaid Services, at least 4,800 long-term care facilities across the country since 2019 have violated patient advance directives, which includes DNRs.
This has to stop. They can't be doing this to other people. You're dealing with people's lives and families.
The lawsuit against the doctor who cared for Leona is still pending in Georgia. Her family settled the lawsuit against the facility for an undisclosed amount of money. Since 2017, the Georgia Department of Community Health has cited the facility 34 times, including not providing proper treatment plans, supervision, and multiple instances of medication-related errors. In Atlanta, I'm Andy Perotti.
Still to come, a shelter dog passed over for nearly a year until she found a home with an owner who can relate.
They both have such stories of damage and overcoming it and finding each other.
But first, a misconception about coconut oil. A majority of people think it's healthy, but medical experts say it could be hurting your heart.
So all these things that we had hoped would be true just aren't.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms. Coconut oil, you can use it to cook or bake. It's even a substitute for butter in some recipes.
It's also been touted to help everything from heart disease to dropping those extra pounds. But at 117 calories, 14 grams of total fat, and 12 grams of saturated fat per tablespoon, it's also gotten some criticism too.
Reporter Viv Williams sorts through the claims in this medical mythbuster.
Coconut oil. It's a food with a history of claims that it can help you lose weight, lower cholesterol, control blood sugar, and even reduce inflammation. But hold on. Experts at Mayo Clinic say coconut oil will not boost your health. In fact, it may hurt it. Let's start with the public perception of coconut oil, what people think about it. The New York Times teamed up with pollsters Morning Consult for a survey that asked people how healthy they thought certain foods are.
72% of Americans polled a few years ago said coconut oil is healthy, but we found that coconut oil is 90% saturated fat. Saturated fat we know can raise our cholesterol levels.
Dr. Stephen Kopetsky, a preventive cardiologist, says high cholesterol raises your risk of heart attack and stroke. He points out that review articles in the American Heart Association's journal Circulation confirm that eating coconut oil does raise your risk of heart disease. So how then did coconut oil get the reputation of being heart healthy? Coconut oil and healthier plant-based oils like olive oil both have what's called medium-chain fatty acids. Your body uses them quickly so they don't accumulate and clog your arteries. But over time, researchers figured out that coconut oil is tricky. Review articles published by the American Heart Association explain that the medium-chain fatty acids in coconut oil act like long-chain fatty acids, the kind found in saturated animal fats, such as butter or lard. Your body can't absorb them easily, so they can accumulate in your arteries, leading to potential health problems. That's not good. So what about the other possible health benefits? Does it still regulate blood sugar and weight loss and reduce inflammation?
The studies have shown that it doesn't, that it does not help your sugar, it does not lower your weight or lower your fat, and it is not anti-inflammatory. So all these things that we had hoped would be true just aren't.
Dr. Kopetsky says you don't have to totally give up coconut oil, just don't use it as your main source of fat. What oils should you eat? Dr. Kopetsky recommends extra virgin olive oil, avocado oil, or nut oil. With this medical mythbuster, I'm Viv Williams.
Next on Investigate TV Plus.
What a good dog you are.
Both scarred by the unexpected, they formed an uncommon bond.
I saw her and I thought, that's perfect actually. We were like a really good match.
The story of a man and his best friend as they work through challenges together.
You can watch Investigate TV Plus anytime, streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download.
They're described as the perfect pair, a man who survived a dangerous infection and a foster dog who got caught in an animal trap.
Reporter Amanda Hara shows how they found each other in Knoxville, Tennessee.
All of us have lost something in life.
It's just horrible.
A game we wanted to win.
Did you think you do everything right and you lose? And it's like, ugh.
Time we can't get back. Someone we love. And sometimes we lose part of ourselves.
I used to love dancing. I can't dance anymore. I used to love skiing. I really can't ski anymore.
Gloom, despair, and agony on me. In 2021, flesh-eating bacteria landed David Jackson in a Seattle hospital. No luck at all. Before he woke up, his niece was his power of attorney.
She made the call.
To amputate your leg.
When I found out she did, I said, thank you.
Because it saved your life?
Yeah. I've told her several times that it's a bill I can never repay.
He couldn't repay his niece.
Come on.
So instead,
there you go.
He paid it forward.
Come on, baby. Come on.
To a shelter dog named Karma.
This is huge steps for her. What a good dog. There you go. Karma and I have 4 legs between us. And the kids always ask the question, what happened? What happened?
What happened to Karma is hard to hear.
Hey, buddy.
And tough.
What up, buddy?
For Mark Hendrickson to tell.
It looked like she had suffered an awful lot when she came to us. Her foot was about half cut off, in mid-paw, from a wildlife trap. These dogs are, many are discarded, and they need love.
With love to give, David started looking online.
I saw her and I thought, that's perfect actually. We were like a really good match. And she needs someone that can walk her, do short walks, and happy with short walks. Well, I need someone that can short walks with.
Long walks would be too rough on Karma, and they're out of the question for David. He can't use a prosthetic because of the way his leg was amputated.
They both have such stories of damage and overcoming it and finding each other.
After nearly a year at this Tennessee rescue, Karma found a home with David.
The two of them, it was like a match made in heaven. Everybody was just on the verge of tears.
The dog that was passed over for adoption.
She was stuck in foster, waiting for someone to take her home for a year.
And the man who was passed over for jobs.
I had a hard time finding work. Part of it was because I was missing a leg. What a good dog you are.
Lost part of themselves, but found each other.
You have a happier life with Karma?
Yeah. She's really good now. We're in rhythm.
What a touching story. And he said that they were in rhythm, definitely giving so much to each other.
Yeah, they both had something just tragic happen to them, and they're overcoming it with the help of each other, too, which is nice.
Yeah. Well, that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching. Next time on Investigate TV Plus, thousands of people accidentally declared dead by the government.
Being alive and declared dead is no fun. I'd rather be dead and not know what's going on, I guess.
We uncover the simple mistake that can upend entire lives. Plus, heel prick tests catch rare diseases in thousands of babies each year. But our investigation finds some states are worried they can't meet demand for newborn screenings.
Failing is not an option because the babies we're serving, the families we're serving are incredibly important.